What's the date today? What year?
2015 or 6.
6.
No, 5 it is.
Which one is it, Patrick?
If I'm pressing there, is that okay?
Quite painful. Yeah, oh, yes.
Sorry.
It's quite painful, yes.
Sorry.
Oh dear, here we go.
You're doing well,
Yes.
and you're looking well.
Yeah, do you reckon?
I do.
Alan, next time you come here, I want to see that weight down. Say that to me. Yeah.
OK, well, that's exactly what I want you to do. I want you to get your weight down.
It's the haemoglobin in your blood that's low. Yours has come back as saying 54, which is very low indeed.
It's embarrassing and it's humiliating. A 60-year-old man peeing himself, you know, I mean, it's just not clever.
Phones are a bit quiet. Sorry.
Don't say that.
Oh, that's it then. I've jinxed us all. Hello, Final Surgery. Nikki speaking. How can I help?
Come in. Oh, look how beautiful. And this is Grandma, yes?
Grandma. It's my grandma.
That's your grandma?
No,
It's your mother? Oh, thank goodness. I was about to say, you look really young for your grandma.
My mum, yes. It's my mum.
Better take a seat there, Mum. Now, let's pop her out of here, onto there,
Okay.
and strip her down, but leave her nappy on, please.
Okay.
Okay.
That's all
And we'll have a chat. How are things going?
right. It's all right.
All right?
She's good.
First, second, third, fourth, fifth baby?
No, first my baby.
First baby?
First baby. I'm
Wow.
43. Doctor, it's like...
43?
Yeah, it's like $1 million for
$1 million?
maybe more.
Jeez.
Uh-huh.
Wow. So you're a very happy mum.
Oh, yes, I am, doctor.
Are you getting any sleep?
Sometimes it's problems. She have a problem with poo, actually, you know?
Does she? Yeah.
Yeah, sometimes 2-3 days.
Breast or bottle?
No, now bottle, because I getting flu, so I have to take medicine, and after I stop. I know, doctor.
Well, do you know, it's not unusual for babies to have, to have a cycle sometimes, which may take several days.
Uh-huh.
Does she really strain when she wants to go?
Yeah, it's very...
And is it very hard,
Yeah,
the stool,
hard,
when it comes
hard,
out?
yeah.
Okay, we might give you something just to try and help
Okay.
that. Lots of hair.
Yes, she does.
So there's the fontanelle, that's the soft spot up there, that's good. Well, let's have a little look at your ears, so plenty of cartilage there. Let's have a little, I'll feel these ones now. Now this is where we see how strong she is. Oh! And you're going to lift that head? Come on, lift that head up. Whoa! There we go. Oh, now look at that. She doesn't want to let go.
Oh, yes.
See, my children now 18 and 16, so they haven't needed this. Yeah.
So you forget actually how to put it now?
I can still... No, I remember how to do that. Hit good. Now, this is the last one, OK? So this is the one that mums hate.
Okay, that's
This is called the startle reflex. And we sort of keep it there nice and we go, whee! And she startles.
Oh, yeah, yes. She always do like this.
That's good. OK.
So it's all right?
Yes.
Huh?
Perfect.
Perfect.
Do you want to put the clothes back on? OK, so that's good. So it was a normal delivery or was it cesarean? Normal delivery? Good. OK.
Yes.
Any problems since then? Wean, passing bowel motions?
Yeah, problem with the wee, doctor.
What happens?
How I can coughing.
And yeah.
It's
Okay.
gone.
So do you know what you need to do with that?
I'm exercise. because
Pelvic
the nurse
floor
asked me to.
exercises,
Yes,
yeah.
I did, but it's
Really
still
important.
happening.
It means you need to do it more and more.
More and more.
Okay. And it's hard to remember to do it all the time.
Okay.
My mother-in-law
Okay.
used to, every time she stopped at a red light, So we'll just remind her that she would have to do her exercises. So she'll be in the car doing this, you know.
Yeah.
But you've got to remember to do it. So you need to make real effort. You need to do it all the time because you need to firm up those muscles again.
Yes, I did
Okay.
because I was absolutely.
That's a built-in babysitter. That's great.
Yeah, that's great.
That's for you.
Okay.
Okay, so you just need to go and wait again for the nurses so that they can
Nurses.
do the immunisations, okay?
Okay, doctor.
Good luck.
Oh, thank you.
I'm sure you'll be fine.
Thank you, doctor.
Mum's here to help. She'll be
Yes,
fine. She's
yes.
been through this already.
Yes, she is.
Look how big you are now, see? She must have done a good job.
Oh, yeah. Thank you so much for that.
You're more than welcome.
Thank you. Bye-bye.
Bye-bye.
Nice to see you. So, firstly, thank you for having the blood test done. The results have come back and it's looking pretty good. All right. So we wanted to do the special checks of your memory today, Patrick, if that's all right.
Yeah. Patrick came in with his wife on this occasion. It was his wife who was concerned about memory changes. We decided to conduct a memory test. It tests higher functioning, things such as memory, so recall, and visuospatial functioning as well.
Shall we make a start?
Yeah.
All right. Now, the first thing that we're going to do, I'm going to give you a name and an address. After I say it, I'd like you to say it, and then remember it, and then we'll do some other bits. And right at the end, we'll ask you to give me that name and address again, all right? So, here we go. John Brown, 42 West Street, Kensington.
John Brown, 42 Kensington Street. No, 42. John.
Leave it.
That's all right, that's all right. Stick with it.
Yeah.
Do you want to say it again?
Yes, please. Yeah.
All right, I'll say it one final time.
Yeah.
John Brown, 42 West Street, Kensington.
Yeah.
Over to you.
John Brown, 42 Kensington Street.
Right, you've got to remember that at the end of the other ones, all right?
All right.
No, I still haven't got that.
Okay, all right.
Don't worry about it.
I'm not worried.
What's the date today?
19th August.
What month is it?
August.
Yeah, and what year?
2015 or 6. No, 5 is 6 comes in it.
All right.
Which one is it, Patrick?
Sit back, relax, no talking, put yourself on a beach somewhere.
The inhaler that I'm going to give you is pink, so hope you're in touch with your feminine side.
It's lovely when she washes my legs. It feels like I've gone for a massage.
There you go, my darling. Press hard on there, and I'll stab you in a minute.
Fair enough.
Lovely. That's what I like to see. Veins, veins, veins.
All done. Very good.
So, how's things been then?
All right.
Yeah?
Yeah, I'm quite happy with the treatment I've got.
All right, good. And no problems with your chest? No,
No.
nasty chest infections or anything like that? Okay. And so we need to do your blood pressure, so we'll do that.
I always get nervous when I have my blood pressure taken. I don't know why. It's stupid, isn't it?
Okay, that's not bad at all.
Oh, isn't it?
No.
Oh, good.
What was that, 100 and...
144 over 67.
Oh, everything's okie-dokie.
Yeah, so are you coughing much?
Not really, no.
No?
I did, but a while ago, last time I
Small
came, didn't I?
spasms now and
I did
again.
last time, and she said I hadn't got an infection because she tested me, but I'm all right now.
So you don't cough on a daily basis or bring up any phlegm on a daily basis?
No.
Might
have a tickle, like,
just more of a tickle.
Yeah, but I'm all right lately, and better.
Do you manage to do everything you want to do? So sort of, getting dressed, bending
Oh,
forward.
yeah, no problem with that.
That doesn't make you
I
restless.
hoover and everything else.
Sorry?
I hoover.
You hoover? How good.
And change the beds.
all at the time, but
I do all downstairs and then upstairs. And I change my bed and that.
It's only this year she stopped mowing the lawn. She doesn't do the lawn.
I've got a gardener now that comes and does it.
Excellent. So for 91, you're doing really well, aren't you?
Yeah.
Beryl, you seen a nurse today or a doctor? Nurse report, yeah?
It's just kept going.
Go on, I'll find you somewhere.
Is that right?
Go on.
Thank you, darling.
So you live it, darling?
Thank you, darling.
What we're going to do now is I'm going to draw a circle, and I want you to think of this circle as a clock face.
Yeah.
Can you draw in for me the numbers that you would expect to see on a clock face? Lovely, thank you. And now what I would like you to do next is, can you draw in the hour hand and the minute hand so that the clock reads 10 minutes past 11 o'clock? Fantastic. Well done, thank you. And now, back to the name and the address that I gave you right at the beginning.
John Brown.
Yes?
I don't know, can't remember the number, but it's West Street. Do we go further than it? It must be 2016. 2016.
Okay. Fine. Let's have a look. Let's total your score up. That's all the bits that I need to do with you. Thank you. OK, so that's not such a bad score, actually. Memory loss doesn't necessarily mean you have a diagnosis of dementia. There are many other reasons why somebody's memory could be affected. As GPs, we would be looking for the reversible causes, so physical conditions, which may include things such as problems with a person's kidneys or their liver, thyroid problems. Could the patient possibly be having an infection? Things which are treatable, which are reversible. OK, over to your wife. Some questions here. Would you say Patrick has more trouble remembering things that have happened recently? Yeah. Does he have more trouble recalling conversations from a few days ago? Yeah. And when he's speaking, would you say he has more difficulty finding the right word?
Yeah.
OK, so...
Gets very tired in the afternoon.
Right.
Very tired.
OK.
Sits down like that and it's gone.
Right. So, in terms of the memory, that's what we wanted to kind of focus on today. It certainly looks like there might be some changes occurring to the memory. How would you feel about having it further looked into by a specialised memory clinic?
Yeah.
Local.
It is local. They can do really thorough assessments for patients.
Yeah. OK.
All right.
Thanks ever so much.
You're welcome.
With regard to John Brown.
I will do. I'm really glad you remember that one. That's good.
Good.
Well done. Take care, guys.
All right, thanks a lot. Bye.
Ladies, whatever you do, don't fight over me.
Sorry, I'm just in the middle of doing
It's all right, I'm thinking one of them's going to give me the eye in a minute.
If we don't put the note on at the time, we forget, and then that's it.
Of course.
Got to remember to get 2 bags. Otherwise, you've got to remember to get 2 bags, as you won't get one.
Alan Tilbury, please.
in here. Come and have a seat. Right. Is this about blood tests, yeah?
Yes.
Diabetes, yeah?
I've got on well with that tablet.
It's down a little.
Well, it would be, because it's working.
I think that might be overstating the case. Yeah, I mean, it's moved from nearly 100 down to 93, so that I really can't say that it isn't moving in the right direction. It's nowhere near where it should be. Yeah?
Yeah, yeah.
So what we need to do, as always with the diabetes, is a plan, yeah?
Yeah.
I think that there are two options. There's the option that says that the gliptin has had a little bit of improvement, so maybe we should give it a bit longer.
Yeah.
There's the option that says the gliptin has helped a little, but you're still quite a long way off target and we're running out of options.
Yes.
So do we think about insulin?
Right. I don't want to go on to insulin.
Mm-hmm.
I have to admit, I haven't eaten the right things.
Okay.
Yeah.
So you
I've
think
eaten sweets.
He's cut down,
chocolates,
but still eating.
biscuits.
So your diet could stand a bit of improvement.
Phew.
Am I being polite?
A radical
And you see,
improvement.
it's that which is up here,
Okay.
and I'm thinking, you're a bloody idiot. If I'd have cut out the thing and done the test like we've done now,
You think it would be
I would
better?
have had an entirely different reading.
Okay. So the third way is that you stay on the gliptin, but that you work really hard on your diet.
Work a bit hard on it.
Is there anything I can do to help with that? Do you need to go back to the education?
Gaffer tape his mouth?
I can't do that, not on the NHS.
I'll let you.
No, believe me, I'd end up on the front of a paper somewhere.
It's me up here.
How can I help you?
I done the blood test yesterday.
Okay.
I don't know what's happened to me. You scared me. Is something wrong?
No, it's just it looks like you're very anemic.
That's why I'm feeling dizzy all the time, feeling tight, feeling sleepy, feeling, you know.
Yeah, absolutely. You would be with the anemia of that degree. Any shortness of breath at all? Are you short of breath?
Yes, lots. Even when I'm talking, I can't keep it up talking because I feel like...
Let me just do your blood pressure, okay? And your periods aren't heavy?
Sometimes heavy, sometimes normal. Is it red, is it normal?
So we're back to the, do you need any help with the diet? There's an education service run out of Upton where they give advice about diabetic diets, lifestyle education. Or do you know what you should do and you just need to do it?
He knows what he should do. He just needs to apply it.
Yes, I can tell you exactly where
you're going wrong.
Chocolate-coated peanuts.
I should get your diet sheet out again and pin it on the fridge door.
Okay,
I've still got my diet sheet.
So essentially you don't need me to get you any extra help.
No, it's me doing it.
We need a plan. I would have thought that the sensible plan would be to keep you on the pills you are on.
I've just...
Oh.
You say to me, Alan, next time you come here, I want to see that weight down. Yeah.
And I need to step up in the mark.
Say that to me, yeah. And that's been my job then, to get that weight down.
Okay, well, that's exactly what I want you to do. I want you to get your weight down. So, the same medication, but why don't we say that we'll give this, 3 months? That's how long the blood test takes to change.
Yeah, that's fine.
I think that if, at that point, it's still running too high,
then we know.
Then insulin, I think, is probably the only way to go. Are you okay with that?
He just wants to know he's tried all avenues.
Which I think is fine. Now, if anything changes and you want to revert to the let's go straight to insulin, you get in touch with me or Dr. Allen, yeah? Does that work for everyone?
Yeah, sure.
Happy with that?
Yeah, that sounds good.
Lovely. You can escape.
You tried.
With no chocolate peanuts, yeah? Go.
Thanks very much.
Bye-bye.
Thanks very much.
Bye.
Did you suddenly start to feel more like this, or has it been a slow thing?
No. Yes, slow.
Slow.
Yeah, I think it's a sense of 1.5 years now.
Do you lose any blood from your bottom at all?
Just a little bit, sometimes, not all the time.
Not all the time. Any tummy pain at all?
Where?
Anywhere on your tummy?
Yeah, sometimes here, sometimes. Yeah.
Can I just feel your tummy? Is that all right? Put yourself up here. And do you take any medications like ibuprofen or anything like that?
Oh, yeah, ibuprofen or Anadine, yeah.
How often do you take those?
When I feel headache or something like that.
Is that most days or?
Yeah.
Put yourself up there for me. Just going to feel your tummy, all right? So where do you get pain if you get pain?
Not pain, just not pain, just when I feel tight, it's my body, my body hurt.
Okay. Okay, finish. Get yourself up. Oops. Let me just explain. It's the haemoglobin in your blood that's low, okay? Normally, the normal range is 115 to 165, and yours has come back as saying 54, which is very low indeed.
Carmina Puyu. This is Holly, who is a medical student sitting in with me this morning, if that's okay. How can I help?
Sorry about my voice.
Yes.
I have a very bad cold.
Yeah.
But this is not the worst thing.
Yeah.
I was abroad in my holiday,
Mm-hmm.
and I'm afraid I got urinary infection.
A urinary infection?
Yes.
Yeah. Mm-hmm.
I have a very bad pain when I'm urinating.
Right. Burning or?
Burning.
Mm-hmm. Mm-hmm.
Very bad.
How long has that been there now?
Since a week.
Okay. And did you get any antibiotic treatment for the urinary infection?
Yes. I had with me ampicillin.
Okay.
The problem is I still have the pain.
So you have the pain. And how many days ampicillin did you have?
So since Monday, I have a week now.
All right, okay. Mm-hmm. But no better. Okay.
No.
And is the pain in the urethra where the urine comes out, or is it in your lower abdomen, your pain?
When I'm urinating, that feeling, feeling the bladder full, that specific pain.
Yeah.
And I feel like I need to go to the toilet every 10 minutes.
Did you bring in a urine sample with you?
No, not yet.
Can you do one now?
Yeah, I
Yeah,
can.
we'll test it, yeah. If you pop next door and just do a sample and come back, we'll just, So you just want to dip test it first, yeah.
Let me just explain. It's the haemoglobin in your blood that's low. I imagine that this has become so low very slowly, because otherwise you would be, if your blood count suddenly reached that level overnight or over a few days, you would be very unwell. You'd feel very short of breath, but you've compensated because it's happened slowly. So I'd like them to see you at the hospital. Is that okay?
Yeah.
Would you mind waiting in the waiting room then, and I'll just make that phone call?
All right.
Okay, thank you. All right. Sit close by and I'll come and get you in a second. All right. Oh, hi. Is that ambulatory care? Hi, it's Dr. Marshall. I'm a GP in Slough. I was wondering if you'd see a lady who's 41 for me. She had some blood tests done and she's been found to... Well, her haemoglobin's come back as 54 and the blood count also shows that her platelets are a bit raised, so she must be losing blood from somewhere. But if that's a real result, then I'm a bit worried about sending her home because we don't have far to go if she were to bleed anymore. OK, that's really kind. Thank you.
So I want you to take this antibiotic called ciprofloxacin twice a day for a week.
Do you think it's needed to see a specialist?
If we referred you on the NHS, they wouldn't see you for something like this. They need us to go through the pathway. So the pathway is to find out what the organism is, treat you first, find out what the organism is. If it comes back as another set of antibiotics, we might need to change the treatment. and then we need to review you and see whether or not your urine is continuing to be clear. If you had recurrent urinary tract infections, depending on the culture results, then we would treat you preventatively. If you got another infection, then we would refer you, and then they would accept the referral from that point of view. They won't accept a referral out of pathway.
Okay, it is any difference on the if I'm going to the private specialist, because also they need a referral from here.
You could go yourself to a private GP and get a referral, but there's no medical grounds to refer you at the moment. We haven't done the basics. And to refer you without doing the basics, it wouldn't be a high-quality intervention. It'd be a low-quality intervention.
How would I know the result of the test?
You can ring in, or if that's abnormal, I'll be ringing you.
Okay.
So that's what we'll do, and then we'll see what the culture grows, and then we'll advise you. Okay? Okay.
Thank you.
You're welcome. Bye-bye.
Hello, Ollie. Let's go back in. So I've just spoken to them, and they're really happy to see you at the hospital. Okay, and they'll see you via A&E. So if you go to accident and emergency, someone is expecting you. Okay, I would go straight there.
So is this like a really serious? Because she's quite worried. She wants to know like.
Well, we don't have any answers at the moment because I've not got any idea really why you may have lost so much blood. I sent you to hospital because it was likely that there was internal bleeding from somewhere in the gastrointestinal tract, but I couldn't tell from the history where this might be. So I needed some more investigations. But don't worry, okay? Yeah? You're in good hands, and we get this done as soon as possible. Without you coming to any harm because of the low blood count. Okay. There's someone's expecting to see you. A&E. Is that okay? Take the stress with you. All right, try not to worry. But it's a good job you came in when you came in, I think.
All right.
Okay, come back and tell us how you got on. All right.
All right, thank you very much. Thank you. Thank you. Bye-bye.
Bye. Bye.
I knew we'd been 17, it's got a decent aircon.
It does. It smells nice.
Jim's room's got a decent aircon and smells nice, though.
Jim's room always smells really nice, actually, thinking about it. What does he do? He must use about a bottle of air freshener every day. Spraying that room down.
How can I help?
Well, it's about my rib. I had a very, very painful rib yesterday. It was very painful. I could hardly move properly.
Yeah.
So I think what happened is the day before, I was doing some heavy lifting at the allotment. I've got a 5-gallon drum for water.
Yeah.
And I lifted that and a watering can.
Yeah.
And I think that might have done it. So
Right, yes.
It was quite worrying, though. It was
Sure, yes.
quite painful.
Yeah, step off your top. So just show me where it's hurting you.
About there.
Yeah.
Just about there.
Okay, so if you could put your finger on the most tender spot.
Yes, I would say around about there.
There, okay, so let's just have a look, yeah. You're tender there.
Ah, yes.
That's tender.
That's it, yes.
Can I write on you?
Yes. Yes, I think you're reaching it.
How are you here? It's tender there as well.
Yes, it is, yes.
You're okay there?
Well, I can feel it, but not as much.
Not as much, okay. Right, so can we just lie over here? Okay, just get yourself comfortable. Deep breath. And that. If I'm pressing there, is that okay?
It was then, yes, yes. It's quite painful. Yeah, oh, yes.
Sorry.
Hello, mate. I'm all right. Sit yourself down there and we'll get stuck into your acupuncture and then you can tell me what else you wanted to talk about. 14, 20 and 21. How have you been?
Probably the last 3 weeks. It's been quite painful. I needed to get in to see you because the treatment does work perfectly.
Good, okay.
How you been?
Yeah, I've been fine, thanks, mate. Well, in saying that, I ended up in hospital at one stage. But,
Oh, really?
Yeah. But outside of that, yeah, been good. There's a spot here somewhere, isn't there?
Yes.
Tell me when I hit it. Good, thank you, mate. Don't go anywhere.
No, I won't.
I'll be back. Did I tell you the story of when I once saw a chap and because I had to stick him in a different room and I didn't, you know, so I dashed in, stuck him in there, and the way it was put on the screen, I then forgot about him. And that was about like 3 o'clock in the afternoon, and I went home at 6.
No.
My partner rang me at about 6 and he said, what do you want me to do with that chap you've got in room 5? I said, oh, please pull out his needles and apologise.
Yeah.
He did say it was the best acupuncture sessions he's ever had. I'm trying not to do that for you.
So what I think you've done, I don't think you've broken any ribs, but you have some tenderness over the ribs. Most of your tenderness and pain is coming from the muscles between the ribs.
Oh, I see.
Now, these muscles hold the ribs in place, so even if you had fractured a rib, we don't do anything about it because they're held in place and they just heal up. It takes 6 to 8 weeks to do that. But it's the muscles between your ribs that are strained, and I think it probably had to do with that lifting. Because when you lift something away from you, particularly, your muscles have to work hard to splint your chest. And in working so hard, they sometimes tear little muscle fibers and they burst and they liberate their contents, and the immune system mops that up. And that's what causes the inflammation. But don't worry too much about it. It doesn't indicate that there's anything serious. It's just a consequence of an injury, like a sprain.
Yes.
You could help it by putting ice on it, and I give you a gel to put on it that might help a little. So ice and gel.
Yes, okay, I will. All right, thanks very much. Thank you, Doctor.
Yeah.
Very good.
Yeah, nice to see you.
It's quite boring, isn't it, this therapy?
Yeah. It's not so, because you can relax.
Well, you can, yes, that's true. So, Colin, I might get you back in a couple of weeks. Is that reasonable?
That would probably be spot on.
Yeah.
If you could do that.
Yeah. I'll write it down for you. Good. Fantastic. Okay, mate, they're all out.
Lovely, thank you.
It's your next appointment, so we'll see you then.
I'll see you then.
And hopefully a couple of these will, we might get there again.
Yeah, I think so. Thank you very much.
No trouble. See you, mate. Bye-bye.
This, isn't it?
Yes, come in, take a seat.
Do you want me to talk with you?
Yes, please.
Okay. So we come today because she was on antipsychotics.
Yeah.
Oh right, she's come off them herself.
Right, okay.
They were making her like a zombie.
Oh, really?
The quetiapine or?
Yeah.
Yes.
I couldn't stay awake.
Oh, okay.
So I kind of stopped.
When did you stop taking them?
A few months. Wait. About July.
July-ish. Has that actually changed your mood though, or anything?
No, it didn't really affect my mood anyway when I was on them. It kind of just made sure I had less of the mood because I was asleep.
She was put on them because you heard voices and stuff, wasn't it? And saw things. You've still got the low mood, haven't you?
Yeah.
Have you still got the voices and things? Or?
Yeah, still got the voices, yeah.
Emily is a 17-year-old patient and she was under the child and adolescents mental health team for long-standing depression, but also she had been hearing some voices as well, and therefore she had been prescribed an antipsychotic. She also was being planned for an assessment for possible autism.
I mean, Em actually said that she knows they were the wrong thing for her, but she needs to be on something.
Like I stopped for a while, then tried them again to see if they were.
They just zombified her, and it was we lost her totally.
Are you still under the...
She's just coming up to 18. They will chuck her off the system.
Oh, God, yeah, quite soon, actually.
I know.
So there is an assessment being planned?
There is, but I think the time it comes...
Do you need a transfer to the adult services, or does
they
that
do
happen
that?
automatically from there?
Well, Emily's really worried about this.
I haven't talked about it with anyone. No one's talked to me about it.
Yeah.
But also the diagnosis you were talking about, that's like a child's diagnosis. So by the time I'm an adult, it won't really matter.
It's a massive worry for Emily that she's going to be chucked off the system.
Yeah. And have you got a follow-up appointment before you turn 18, or...?
I'm going to ring them. She needs an appointment because really, even just coming off antipsychotics like that is not ideal.
Mm-hmm. If a patient gets caught in limbo between the child and adult mental health services, there is a risk of damage to their mental health, particularly because they may lose the continuous patient contact and consultations. They may run out of medications, and therefore we try not to let it happen as much as we possibly can. Try and rearrange that appointment.
I will. I'm going to ring them today.
Do you want me to give you a call in a couple of weeks to catch up and just...
That'd be great.
If you could find out if they can automatically transfer you to the adult mental health services or whether we need to do a separate referral.
That'd be
if you find out...
Okay.
Just put you down for a telephone call. Is that all right?
Lovely. Thank you so much.
All right,
for
no worries.
everything.
I'll speak to you in a couple of weeks.
Yeah, thank you so much. Bye-bye.
David Smith. Hiya. Thanks for waiting. Come and have a seat down there. How are you?
Okay. The reason I'm here today is embarrassing and it's humiliating. Last week, I took my wife up to Coventry.
Yeah.
There was a problem on the M1 on the way up. Traffic was at a standstill. For half an hour, didn't even move. I was desperate for a pee. I had to get out of the car, stand by the door with a van behind me, cars all around me, and pee on the motorway. That's what I had to do, and I just shrugged at everyone and went, you know. So what? And that's what I had to do, but that is bad. I'm 68 years old.
I used to see you for the prostate side of things.
That's
didn't I?
right.
And then we tried a few things, and then you ended up going under the urologist after that.
That's right. Yeah. I mean, that went on for years, though. You know. I mean, since then I've had the gallbladder out and all that last year.
I just want to remind myself.
I don't know what's going on here, but it's totally, well, it's unacceptable. You know, to me it is.
Yeah.
You know, 60-year-old man peeing himself. You know, I mean, it's just not clever.
I've got a problem with urinating. Sometimes it's really slow, sometimes the stream is quite good.
Okay. It certainly looks cloudy, doesn't it?
First of all, I've got a sample for you. This is what I'm managing to do 20 times a night. And so I didn't get much sleep last night.
And it's painful.
Yeah, the urine's all okay.
Sometimes I can stand there and when you think you're just about to pass water, it doesn't.
There you go. That pink at the top is a pretty positive sample.
Right.
We can throw that over here.
Well, actually, I like it a little pop. It's quite sweet.
When I feel it coming, I've got to go immediately.
So how long has this all been going on for?
For a while now, you know. No one is more meticulous than me about personal hygiene. I hate it.
When they tested you last time, they found things like tightening, what's called a stricture. So they found a tightening along the way that might have been part of the reason you were getting symptoms. They tried to rectify that by opening up the bladder, the opening of the bladder into
That's
the...
right, yeah.
And they also tried to dilate the...
I remember them doing
ureter, So they tried to do that to try and make things better. So I wonder whether it's actually worth referring you back to them as well, rather than me messing around with medication.
Okay.
However, what we could do... What we could do is give you medication to try and deal either with the prostate or the bladder while you're waiting for that referral. So at least you'll have done some of the steps along the way,
that may be helpful.
and doing your bloods and the PSA and all that stuff as well.
Yeah.
So I think that's probably the best thing.
Okay, I'll go with whatever you say.
Referrals.
I said to my wife, jokingly, I'll probably end up wearing adult nappies.
While you're waiting for the referrals, if things change or you're worried, come back to me.
Okay,
Or to one of us.
Right, thank you, Doctor.
Take care, right.
Thanks a lot.
See
Thank
you.
you.
Bye.
Coffee, no sugar.
Tea, white, 2.
Tea, 2 sugars. Does Charlotte want one?
No?
Who didn't empty their cup?
There was no need for that.
Sorry.
Have a seat.
Chris, I got myself in a mess. Right, my list. I'm in a mess.
Are you?
It's this foot. I came down the stairs, the last 2 steps, for some unknown reason, I just took off and landed on my feet. I lasted that night.
So you didn't actually fall?
No, I was on my knees.
You did, right.
Next day, A&E. X-rays, they said no fractures or muscles and tendons. They gave me cream and tablets. So here we are. But the pain, Chris, is gone from there to here to here. Now, it's all gone stiff and the skin is tight. How can I get rid of it?
Should we have a look at it? Do you want to pop on the couch?
Yes, sir.
In fact, if you could leave your leg here, I'll have a look over the weekend and sort it out for you and put it back on Monday. Is that sort you?
Why not?
So this is the leg, isn't it?
Yeah.
So you say the skin is tight?
Yeah.
Does it just feels tight, yeah?
Yeah.
Okay. It's a bit swollen, isn't it, the leg?
Yeah.
It looks okay, though.
Yeah,
It's in good condition.
We're doing all right.
Yeah. It's not too tight, it's not too swollen. Calf's nice and soft. Skin looks okay. So I know it feels tight, but it's more of a feeling than it because it is swollen. Yeah. Do you want to sit yourself up?
Please, sir.
Here we go. There we go. That's it. Now. So the main thing is uncomfortable, isn't it? The whole leg. It's just going to take time.
Is it?
Yeah.
So what do I do? Leave it alone now?
Best thing you can do is keep walking, keep mobile on it, keep doing what you need to do.
No gel. Don't know if you'll understand this.
So the IV gel, that's good. So I'll tick that, yes?
Yes, please.
Naproxen, no. Put a cross by it.
No.
The cocodamol, no.
No.
Put a cross by it. But you can have paracetamol.
Yes.
Yeah?
I've got some of them.
OK, so I'll write it down on here for you. Elderly patients, like lots of patients, are sometimes lonely, and the general practitioner is there as a friend that they may have known for many years and someone who is easy to have a conversation with. And I think lots of people find it reassuring to be able to talk to their GP about the ups and downs of life. This is one of the functions I think that GPs provide really successfully for patients.
Oh, dear, here we go.
You're doing well.
Yes.
And you're looking well.
Yeah, do you reckon?
I do.
People say that, but...
I do, yeah.
Anyway, I'll let you get on with these other people.
Nice to see you.
Thanks, Chris.
OK, I'll see you in 2 weeks' time. OK, I'll send you the appointment.
Lovely.
It'll be Friday morning.
OK,
take
sir,
care.
thank
Have a good day. Bye-bye.
Bye-bye. Do you want to shake hands? Bye-bye. Oh, it's lovely, yes.
Right, cheers for that.
OK, hope you feel better soon.
Thank you. See you later.
Take care. There you go. All right. Take care. See you. Bye.
Bye-bye.
Bye. Bye. Bye.